I'm Michael Becker. I'm a neurologist with Paradigm Health Systems, and I've worked on the North Shore for 15 years now. I was born and raised in New Orleans, so I've lived here my entire life. I'm a general neurologist, so I see every type of patient that has a neurologic disorder. Probably the number one diagnosis that I see is migraine headaches. It's a very common disorder, but we also see patients with strokes, seizures, back pain and neck pain, really anything that has to do with the nervous system. Well, a migraine is a headache that's typically a genetic condition. We oftentimes find someone else in the family that has migraines. And the migraines do vary in severity. Some get just mild headaches, but they get them frequently. Or they can have very severe headaches that occur once a month or once every few months. So they're very variable as far as how severe they are, how often they happen. But migraines have become much more treatable now in the last 20 years than they were before. We have a number of different medications now that we can use to alleviate patients' headaches. The main symptom of a migraine is obviously a headache. That's the number one thing that patients come in complaining of. But there are many other associated symptoms with migraines. You can have everything from nausea to light sensitivity. You can even have difficulty talking because of a migraine. You can have numbness associated with it. There's a very great range of symptoms that go along with migraine. Triggers vary individually. Different foods can certainly be a trigger. Everything from alcohol, Chinese food, those kind of things can do it. Stress is a big trigger for a lot of people. Lack of sleep, those are the most common things that we see. The process of diagnosing and treating a migraine just starts with taking a history from the patient, finding out how long they've had the headaches, how bad they are, how frequently they occur. Oftentimes we'll get into what treatments they've had in the past, what kind of testing they've had in the past as well. But usually I can tell from the history whether a patient's suffering from migraines or not. And then the treatment options we run through range from preventative measures, things that they can do to avoid the triggers for their migraines. We also have a great number of medications now to not only prevent migraines, but also to treat them when they occur. The thing that sets Paradigm apart when treating neurologic disorders such as migraine is the individual attention that we give each patient. We spend at least 30 minutes with each patient, finding out what's wrong with them, how long they've had the problem, and exploring treatment options for them. The reason to see a neurologist for headaches is if the headaches have become disabling in some way. They're interfering with your life. They're occurring so frequently that you're having to take medication several times a week. If the headaches have become more frequent than you're used to, or if the headaches are so severe that you find yourself thinking maybe I should go to the emergency room for these headaches. Those are the kind of patients that we typically see with headaches in our clinic.